Cancer touches almost everyone's life. Insurance coverage for pre-existing conditions like cancer is one part of the new healthcare reform law that drew bipartisan support. Cancer advocates say the changes could save lives. It's the focus of tonight's In Depth.
My diagnosis was February of '99. I do not have health coverage. My most recent chemotherapy was 10 days ago. I'm not sure what I'm moving anymore out of that box.
35-year-old Ruben Garza is starting an exciting chapter in his life, moving into this house with his girlfriend. At the same time, he's coping with the return of his cancer. A few months ago, Garza was ordered to begin a new round of chemotherapy to treat a recurrence of Hodgkin's lymphoma. His current job doesn't offer medical insurance.
Chemotherapy is not cheap at all, and each cycle, which I was having every 2 weeks, was about $900.
Cancer is costly. Garza's been fighting lymphoma on and off for 11 years. He says finding ways to pay for treatment has been as tough as battling the disease itself.
I had to jump through a lot of hoops. The process of getting taken care of in spite of things is very taxing. There's a lot of things that you have to, that you're asked to provide, a lot of things you have to reveal about yourself, your finances. And to be honest with you, there's definitely a humiliation factor involved with that.
Garza's hoping healthcare reforms will take away some of that humiliation. Under the new rules, insurance companies can no longer deny children coverage based on a pre-existing condition. Starting in 2014, insurance companies cannot deny coverage to anyone with pre-existing conditions, and insurance companies must allow children to stay on their parents' insurance plans until age 26. Cancer survivor Doug Ulman is the CEO of Livestrong, Lance Armstrong's foundation dedicated to improving the lives of people with cancer.
For a long time, people with cancer, felt trapped. They felt paralyzed by their sort of inability to switch jobs, switch professions, to pursue their dreams because their insurance was so tied to their employer.
Ulman sees the reforms as a way to even the healthcare playing field.
Well, we hear from people every day who are either newly diagnosed or survivors, long-term survivors, who are constantly frustrated and constantly fighting an uphill battle to try and get coverage for things that they think their plan's coverage, to try and get coverage for things like clinical trials, to try and make sure they have the best chance at surviving.
Researchers say right now only about 3% of adults with cancer actually take part in clinical trials, in part because many insurance companies don't cover them. Oncologists are hoping expanded coverage of these clinical trials will lead to less toxic and more effective treatments for cancer.
I think in the mind of oncologists, this is a true bullet point. We need to get to this point where we can offer all of our patients a trial and have them not fear that they're actually going to have to pay more out of pocket because of their contribution to the future of cancer research.
Cancer research, treatment, and survival rates have made great strides in the past 20 years. Advocates hope improved medical coverage for people with cancer will be one more step in the right direction.
But at the end of the day, we at Livestrong feel like this will save people's lives. And, I'm not sure there's something that could be done that's more important than that.
Now, I talked with Jerry Johns, a longtime spokesman for the insurance industry. He says these reforms are so new, insurance companies are still taking a close look at what they will cost and how to implement them. But he says if someone has a life-threatening pre-existing condition, the insurance premium will likely be expensive.